Hi, my name is Shiva, and I'm the co-founder of Biopeak. And today I have the privilege of having Dr. Satchin Panda, who happens to be the professor at the Salk Institute for Biological Sciences. And he's a world-leading authority on the circadian rhythm and also time-restricted eating and a bunch of other things that we will discuss later today. I also have with me Dr. Arvind Bhateja, who happens to be a leading neurospinal surgeon and an avid cyclist who puts himself through grueling situations every weekend. Dr. Arvind is a part of our advisory board, the clinical advisory board, and Dr. Panda is a part of our international advisory board. And I'm really happy to have them here today because what we'd like to discuss is the circadian rhythm and brain health. What makes today's conversation really interesting is that we're sort of covering the continuum of health, if you will. Dr. Arvind sees the worst consequences of health, the worst consequences of clinical health. And what we do at Biopeak is manage the whole health span and the journey to longevity using testing, data, and interventions. And of course, Dr. Panda sits at the foundational science of knowing all the reasons of why that whole thing ties in with the rest of what we do. So it's going to be really interesting because unlike a regular conversation, as you can see, he's in his scrubs. And, this brings what happens in the reality of existence all the way into how we apply the deepest theories of science today. So if I may quickly ask, Dr. Panda, can you just briefly, how would you define the circadian rhythm today? Just, broad perspective.
Yeah, so the word circadian literally means 24 hours rhythms. And then if you think of what we actually do throughout the day, daytime is for action and performance. And then the nighttime is for repair and rejuvenation. So this alternating cycle of performance and rejuvenation is what maintains our health. And then if we ask like how is this cycle going on, then what we see at the molecular and cellular level, almost every cell in our body and brain has its own clock. So that means every cell has its own time when to perform. If it is a brain cell, then it has to think and do certain things during daytime. At nighttime, it has to repair itself, or the whole brain has to detoxify and re-establish connection. So similarly, our skin cells also have their circadian clock. So the daytime, they give us protection. They form the barrier so that bacteria and allergen don't go through the skin. And at the same time, daytime we're exposed to sunlight, which has UV light that can damage DNA. So the circadian clock makes sure that the skin does its work during the day, and at night time, the skin cells that are damaged are removed, and new skin cells are formed. So these are some examples, few examples, but almost every hormone, every neurochemical, every digestive juice, every gene in every cell or in a tissue specific manner goes up and down at different time of the day, and the coordinated action gives us these daily rhythms and performance and rejuvenation.
Thanks, Dr. Panda. Dr. Arvind, may I ask you this question? So, what do you see in regards to brain health at the clinic? I mean, what are the kind of cases that you see? Because we're talking about the continuum of health, and you always see, what is at the end of that continuum. What is it that you see? I mean, for everyone, I suppose, they actually don't know what you see every day.
So, neurosurgery is actually a very vast specialty and it has become more and more nuanced in the last few decades. And I only deal with a very small part of it. There are other members in my team also who deal with other branches of or subspecialties of neurosurgery. But overall, I would say as a department, we deal with the commonest types of brain tumors, which can be all types of tumors that arise anywhere in the nervous system. It can be in the brain or in the spinal cord. And we also treat patients with strokes, patients with hemorrhages in the brain because of high blood pressure, because of aneurysms. We also treat patients with spinal diseases. And predominantly the spinal diseases we treat are patients with degenerative disease. And degeneration, as you know, or you probably could know, is that the worse your degeneration often signifies that you've led a very poor lifestyle. And that's something that we see very often. So we try to look at a patient as a whole rather than just treating the disease. Of course, with tumors, you have to definitely focus a lot on the disease. But when it comes to things like strokes and things like spinal diseases, like degenerative diseases, we try to focus on the patient as a whole and try to look at their lifestyle. What kind of diet do they have? Do they perform any form of regular exercise? How is their sleep? What is going on with their hormone? Because we get a lot of women who are in their perimenopausal, postmenopausal, or menopausal phase in life, and they come to us with a very diverse set of symptoms. And sometimes we have to try and define, are those symptoms really related to the spine, or is it something hormonal?
Thank you, Dr. Arvind. Dr. Panda, this is a very good opportunity for us to explore chronomedicine, actually, right? Even in terms of when do we do a surgery and things like that? Because I suppose we don't consider that in the urgency of a situation. It'll be great to hear some thoughts about, what chronomedicine is and how you would approach it.
Yeah, so just break it down to, like, for example, as I said, almost every hormone, every digestive juice, everything has a clock or rises up and down. So very simple idea is, suppose our insulin sensitivity or insulin production is much better in the first half of the day. So that means we can eat a good amount of healthy carbohydrate in the first half of the day and not in the second half when the insulin producing cells are kind of sleeping or trying to recover themselves. So now suppose say we extend it to replace that carbohydrate with a medicine. And when we take any medication, then it goes through our stomach, has to be absorbed, and then it goes to liver. Sometimes it's slightly changed based on what enzymes we have, and then it has to go to the target area. So if it is the drug for the liver, then that's fine. But if it's drug for, say, pancreas or for the brain, then it has to go there. And then after it goes there, then it has to act on its target, because usually every drug that we have ultimately goes and either turns on or off a specific gene product, which we call, and which can be an enzyme, which can be a neurotransmitter, XYZ, it's all of that. So now, as I said, almost every gene or every digestive juice or everything in our gut lining that absorbs different things can have a circadian rhythm. Now we can go back to actually huge databases of which genes turn on and off at different time, and we can even predict that this drug taken in the morning may be better absorbed, or it may be better absorbed but broken down in the liver, or if it goes through gut and liver, it actually has a much better efficacy because the target is there. So that concept is chronomedicine. So giving the medicine at the right time so that the medicine is more effective. And as we all know, sometimes if the dosing is not right, if a given dose is not treating, then we escalate the dose, we increase the dose, and higher dose we also have adverse side effect. So the point is, can we optimize timing so that we can treat the disease with just enough medicine with reduced side effects and improved efficacy? So now there are quite a few examples. So of course, this is a little bit debatable because depending on which medicine you are looking at or which brand name and which dosing, blood pressure usually goes down at night time. And people who have hypertension, there are two different types of hypertensive. One are the dipper who dip at night, and one who don't dip at night. And those whose blood pressure remains high throughout night, they are at a higher risk for subsequent cardiovascular event. So then the idea is, just like you'll never take a sleep medicine in the morning, but in the evening, should you take a short-acting antihypertensive drug in the evening? And there are large studies showing that yes, evening short-acting antihypertensive medications are much better than the same medication taken in the morning. But when it comes to long-acting medications, then you don't see that timing effect of timing that well. But then the other class of drugs that actually have been now translated to medicine is pain medications for arthritis pain. And usually our joints are more stiff in the morning, and people typically take the reflex reaction is you should take the pain medicine in the morning when the pain is more. But actually, our cortisol level begins to rise towards morning. So if you have these medications taken at bedtime, then they seem to be more effective in reducing pain in the morning. So now that has been translated to slow acting, slow release medications that can be taken in the evening or bedtime, and they seem to manage pain in the morning. So there are many, many examples like that. All of this started in 80s when some researchers looked at chemotherapy for breast cancer, and they found that women who took certain breast chemotherapy in the morning, they were seeing much better benefit than the other. But it's not universal for all chemo for all breast cancer. And then there are certain chemo that actually work much better in the late afternoon. So this has been now expanded to many, many different drugs, because out of FDA approved drugs, all the drugs, nearly 85% of the drug target themselves are circadian. And then if we combine the drug transporter that absorb drug, then it's almost nearly 100%. But it doesn't mean that every drug will have that kind of effect, because many drugs are long acting. Once you take it, they are there in our system for 24 hours or 48 hours. For them, the timing may not matter, but there is always surprise. So for example, right now for certain kind of cancer, now the immune checkpoint inhibitors are the most effective classes of drugs. And usually these immune checkpoint inhibitors are given once in every few days. There is a dosing cycle. And what was surprising was they found that when these drugs are first given in the morning versus evening, that had a huge impact on the outcome. And even the first time the immune checkpoint inhibitors are encountering their target, that timing seems to have an effect. And that was a very big surprise, because these drugs actually, these checkpoint inhibitors stay in our system for many, many days. So we're just learning this, and then some of these are being translated to practice, just like the pain medications, and then some are in the pipeline.
May I ask a question? Is there any evidence or data to suggest that doing surgery on someone in the morning is better than doing it in the evening, for example?
Yes.
And not only from the point of view of the patient, but also from the point of view of the surgical team.
Yeah. So there was one study that was in, I'm not sure, New England Journal or JAMA, one of them. It was aortic valve replacement, I think, that surgery. And it was done, the study was done in the same hospital, the same surgical team, working in the morning or in the afternoon. And I guess they had close to 500 cases. And they found, I don't remember correctly whether the afternoon surgery or the morning surgery had, when they looked at 5 years survival, then either the afternoon or morning was giving much better benefit. And then they went back and genotyped and then figured out, they suspected that there is a clock component, there is a gene that encodes a part of the clock. And that gene may be responsible, because they went back and manipulated that gene in mice and then showed that there is some effect. So the point is, even the first time when you're doing the surgery, because the recovery from surgery in the first 24 hours is very important. And the idea is that recovery is time dependent. And then there are other studies, those are in mice. So in many liver disease, as you know, a liver resection or taking out part of the liver is a very common surgery. And in mice, if that liver resection is done in the morning versus evening, then the time it takes or the days it takes for the liver to fully regenerate has that time of the day of the surgery effect. And those have been linked to now clock component and one of the cell cycle genes. So it's, yeah, we are always seeing surprises where we think, no, there may not be any effect, but then you go back, do the experiment, and there are effects.